Our skeleton is an absolute masterpiece of engineering, right? But it's not unbreakable. So today, we're going to get right into the story of a broken bone. We'll explore what happens from that first crack all the way to how our bodies, incredibly, manage to heal themselves.
So here's our game plan. We'll start with the break itself, then move on to diagnosis, the repair job, the actual healing process, and finally, we'll touch on some of the risks and what recovery looks like. Let's jump in.
All right, first things first. Before we can even talk about healing, we've got to understand what a fracture really is and all the different ways a bone can actually break. At its core, a fracture is exactly what it sounds like, a break in a bone. Simple, right? Well, not so fast, because how a bone breaks tells you a ton about the injury, and it's actually pretty fascinating.
So let's start with a really straightforward one, the transverse fracture. This is just a clean, straight break right across the bone. Imagine snapping a twig in half. That's basically what's happening here. It's usually from a direct, hard impact. Then you've got the oblique fracture. This one breaks at an angle. So instead of a straight-on hit, it's usually from a blow that comes in from the side, causing this kind of diagonal snap. Now, this one's pretty gnarly. A spiral fracture happens from a twisting force. Think about sports, like planting your foot and then twisting your body suddenly. That force can cause a break that literally spirals around the bone. And then there are the really serious ones, a comminutive fracture. This is where the bone doesn't just break, it shatters into 3 or more pieces. We're talking major trauma here, like a car crash. And as you can imagine, putting that puzzle back together is a whole lot tougher. Okay, now for something you see mostly in kids, the green stick fracture. Their bones are way more flexible than ours, so sometimes a bone will bend and crack on one side, but not break all the way through. The name is perfect, right? It's exactly like trying to snap a fresh green twig. All right, so we've talked about the type of break, but there's another really critical distinction to make. Is it closed or is it open? A closed fracture means the skin is still intact over the break, but an open fracture, well, that's where the bone actually pokes through the skin, and that is a huge deal because now you have a major risk of infection. Okay, so let's say you've had a nasty fall. How do you know if it's just a bad sprain or if you've actually broken something? How do doctors figure it out? Well, your body is going to send you some pretty loud and clear signals. I mean, there's the obvious stuff like pain and swelling. You probably won't be able to move it. But there's also this awful grinding feeling or sound. It's called crepitus. And yeah, that's literally the 2 broken ends of your bone rubbing together. Yikes. But all those symptoms, they're just clues on the outside. To get the real story, you've got to see what's happening underneath the skin. And that's where the good old X-ray comes in. It's the gold standard. They'll usually take pictures from a couple of different angles, and that gives them a crystal clear map of the damage, exactly where the break is, what kind it is, and just how bad things are. So, the X-ray confirms it. The bone is broken. Now, the real work begins. The road to repair starts right away, from first aid on the scene to the final fix at the hospital. Right, so let's talk first aid. The absolute #1 goal here is not to fix the bone, but to stop things from getting worse. You want to immobilize it, use a splint to keep it still. If it's an open fracture, you've got to control the bleeding and cover that wound to block out germs. And then obviously get professional medical help fast. Okay, once you're at the hospital, there are basically 2 main paths they can take. The first is conservative or non-surgical. They call it a closed reduction. Fancy term for the doctor physically moving the bone back into alignment from the outside, then locking it in place with a cast. The other path is surgery, or an open reduction. This is where they actually go in, put the pieces back together, and use stuff like plates and screws to hold everything just right. So, whether it's a cast or some internal hardware holding things together, the bone is now set. And this is where the magic happens. The body's own amazing internal construction crew clocks in and gets to work. And what a job it is. It happens in stages. First, you get a blood clot at the site, which is kind of like the cleanup crew. Then, the body starts building a soft bridge of cartilage across the gap. This is the scaffolding. After a few weeks, that scaffolding gets replaced with actual hard bone, like pouring concrete. But it's not done yet. Over months, sometimes even years, the body keeps remodeling that area, smoothing it out and making it stronger, until it's practically back.
Thanks for watching. Do like, share, comment, and subscribe our channel.